Hey everybody, I'm Dr. John Degenhardt. I've been in practice now for almost 45 years this October, and I'm being honest, I don't want to quit. I want to go as long as I can. I think you get better wisdom, better understanding the longer you practice as a chiropractor, as an attorney, as a cardiologist, whatever. I want to share my heart with you. I have heard so many people over the years say, my neurologist said, don't go to a chiropractor. My medical doctor said, don't go to a chiropractor. My neighbor said, don't go to a chiropractor. I started this show 35 years ago because I want to talk about these issues. And I want you as a public to, I'm going to share my heart, what I've seen behind the scenes. So stop for a glass of water, but I'm going to use your time as valuable as I can to see what have I seen. Why are people told that? And is there some truth to them being told that? So let's take a break. Come on back. We're going to talk about why are doctors telling you not to go to a chiropractor. Again, what would you do? Let's tell you a true story. A college girl comes into my practice, maybe 21 years old, let's say, migraine headaches. From a chiropractic viewpoint, she sleeps on her stomach. She's twisted her neck for 5 years. Migraines. Sees a neurologist. CAT scans of the brain. Negative. Strong medications. Bad side effects. She gets a second opinion. She comes to my practice. So I say to her, you must stop sleeping on your stomach. You must stop twisting your own neck. My job is to correct the misalignments. The headaches are nothing wrong with the head. Headaches are from her neck. She goes to me. My neurologist said, never let a chiropractor adjust your neck. So I said to her, I won't. But I said, let's talk about it. Well, my neurologist said that twisting the neck can cause strokes, it can cause damage, it could even kill me. So I said to her, I said, I'm here all of these years. I've had hundreds of women where neurologists will say that. Now let's explain if we could. Research shows the malpractice insurance of chiropractors is the lowest of any doctor. I pay $1,200 a year. If my adjustments were causing a lot of strokes or damage, who would know about it? The insurance companies. Where medical doctors are paying $40,000 a year for malpractice and surgeons $300,000 a year, apparently we're not hurting as much people as they think. Yes, do some people get hurt by chiropractors? Yes, that's why I'm talking about this show. There was a show on Call a Doctor in the past. 3 doctors, chiropractors on the panel were asked, does a chiropractic adjustment ever hurt anybody? No, it's always safe. It always gives benefits. That's a lie. Anybody watching this show, you ask your family members, have they ever been hurt by a chiropractor? Yes. What do you think I've heard in my practice for 45 years? This other guy across town crunched me. This other guy twisted my neck so hard. Communication, I've said in my articles in the newspaper, is so key. You as the public must communicate to your chiropractor. If you don't want a rough adjustment, if you don't want your neck cracked, don't do it. So communicate properly. I do not crack everybody's back. I use a drop piece table. Some people I do twist them. Depends on their age, if they have spurs, bad discs, their history, all of those factors you have to consider. So this college girl, let's get back to that story. We fixed her lower back. She comes in and says, I have all these lumps in my neck. I can't even study. She goes, I'm grateful you were respectful of my request and not to work on my neck. But the more my mom and dad talk to me, they say to trust you, that could you gently adjust my neck so my neurologist, I could tell him what you've done. I said, I think I could. I said, I think I could gently fix your neck so your neurologist doesn't know that there's gentle chiropractors. Most of the public, most doctors think that all chiropractors are just rough. So I very gently get her head and get one gentle little click. She comes in 83 miles. She travels from college to see me on Saturdays. Next visit, another little click. 2 or 3 visits. All the lumps are gone. All her headaches are gone. Guess who calls me? Her neurologist, screaming at me. How dare you twist my patient's neck? I told her not to see a chiropractor. I said, sir, in all respect, I agree with you. She should not see a rough chiropractor because she was epileptic when she was younger. So he gave her epileptic medications. He knows her for years. But I said to him, did you know she was a stomach sleeper? No. Did you know that she was twisting her own neck that from a chiropractic perspective was causing pressure in her neck, resulting in nodules, which are lumps in the muscles? No. I said, Dr. Neurologist, if I was rough with her neck, I would have agreed with you. But I said, I know my limitations. We gently got one click, gently got another click. I said to him, calm down your anger and ask me, how is she doing? Her migraines are gone. Her nodules, her lumps are gone. Her mobility is normal. So if a chiropractor knows his limits and isn't rough and egotistical and just cracks away, chiropractic is such a beautiful profession. This doctor of neurology, we ended up talking nicely. He ended up saying, you know what? I didn't understand that there were just gentle chiropractors. He has had patients hurt by rough chiropractors. So I understand his bias. I understand his anger. But I was willing to take his anger and absorb it and say, listen, doctor, I did not hurt your patient. Her migraines are gone. Her nodules are gone. I will never tell a patient to stop medication. She asked him to stop the migraine medication, and that's why he called me. So number one, this neurologist told this patient not to see a chiropractor because he felt it would hurt her because she was epileptic when she was younger, hasn't had any seizures in years. I never told her to stop her meds. I respected her fears. I explained to her that I understand the neurological fear of being too rough. So for the first episode of the show, I respect you if you've been told or you feel I should never see a chiropractor. Maybe they're too rough. Maybe some chiropractors hurt people. And it's true. It happens. Communicate. Be more gentle between the doctor and the patient. Beautiful things can happen. Next segment, we're going to talk about why surgeons tell their patients, or really degenerated surgical patients, don't see a chiropractor. Let's discuss that. Thank you. So here's the question. Have you ever been told by anybody, doctor, friend, don't go to a chiropractor. They'll kill you. They'll hurt you. Many people have. I'll be honest with you. If I never went to a chiropractor, I don't think I would have such a beautiful life that I have. I ruptured my disc. Nobody was helping me. I know the frustration of you watching this show, that you try everything. Epidural shots and acupuncture and traction and physical therapy and you've tried it all. Sometimes the right chiropractor can change your life. Last week's show, we changed someone's life by flying all the way to Florida to do proper chiropractic. Here's what I get all the time. Doc, I have a brother who has a herniated disc. He's in such terrible pain he could barely walk. His surgeon said to him, don't go to a chiropractor. But nothing's helping. My brother's afraid of surgery, or his friend got bad results from surgery. What do you think? A gentle approach with a herniated disc, with spurs and stenosis and all these fancy terms I could give you, will make great results. So the patient comes in, and I love my work. You walk in that room, and there's a guy, terrible pain, doesn't want surgery, nobody's helped him, he's afraid of seeing a chiropractor. So I say to him, I understand You're afraid to be here today. Yeah, I am. That table looks terrible. I said, I know it looks like a stretch rack. But I said, I promise you, I'm not going to hurt you. If ever you watch this show and you felt worse after the chiropractor, he did something too much. He or she did something too strong. If they say to you, no pain, no gain, you have to get better or worse before you get better. Not true. Not true. They're too rough. They have to analyze and say, okay, is there a fissure in the disc? Is there spurs and stenosis and arthritis and a herniated? All these things you have to consider. So then you have to be more gentle. So lo and behold, this man who's been told by his doctor, don't see a chiropractor, out of frustration and out of terrible pain and no other options, comes to me, lays on my table, and I always ask those patients, come with somebody else. We videotape them. They take a video on their cell phone. So he lays on the table and his right leg was an inch longer. We videotape it. We tap it gently. I said, did that hurt at all? No, I didn't feel anything. No cracking, no twisting like you see on these terrible TikTok. You know, these TikTok chiropractors, they get a rope and they yank people's necks. I get scared watching those videos. I've called those chiropractors. Their egos say, John, I have 300,000 followers. I don't care if I scare the public. I do. Because then the public think that that's what chiropractors do. I don't know of anybody except for TikTok that gets a rope and yanks a neck. And that should never be done, in my opinion. No wonder medical doctors and neurologists tell people, don't do, if they see that stuff on TikTok, they're going to say, don't go to a chiropractor. So getting back to this patient. We adjust him, we recheck the legs, and again, you've seen this on my TV shows. The legs get level. Means the back is in place. And the person taking the video, you have to be there. They're like, what'd you just do? You didn't crack him, you didn't twist him, the longer leg, and said, all I did was shift his pelvis. And just like my show of last week of the Vero Beach patient, do you think a man who is surgical is going to get better overnight? No. I look at him in there and I say, all I did, I am a body mechanic. All I did was get your pelvis in alignment. Now you must give your body 30 to 60 days for the discs to heal, the tendons, the ligaments, the muscles. So I tell them right up front, don't expect any fast miracles. I get every now and then, I did a show 3-4 months ago. This, I think he was a 82-year-old man. He felt better quickly. I did not expect that. That is not the norm. Most of you watching this show have chronic damage. You're going to heal slowly. I love these surgical patients. And it has happened hundreds of times in my 45 years that 2, 3, 4 months later, they're golfing, they're walking, they're traveling. They go back to their surgeons. And the surgeon says, I had one guy call me once. He goes, what did you do? He said, the MRI is so degenerated. I said, I don't crack these patients. Well, how can you move the spine if you don't crack them? I thought that's what you chiropractors do. Doctors who say to you, don't see a chiropractor, they don't want you to be hurt. But they don't know that chiropractic could be gentle, that it could happen slowly and gradually. We live in a fast-paced world. You know, you take a pill, you want your migraine to stop the next day. A truthful chiropractor says to these surgical, even post-surgical patients who don't get better after back surgery, I still can get them better by getting them in alignment. So the question is, have you been told by some doctor or friend not to see the chiropractor? Your response should be, I will not go to a rough chiropractor. That girl, if I cracked her neck, the neurologist would have called me screaming. This surgical patient, if I crunched his back, he would have needed surgery. And I get those patients who are injured by other chiropractors. So to be blunt with you, do you think I help everybody? I don't. Am I against other chiropractors? I'm not. I wish these guys would have a multitude of techniques for different patients. A 25-year-old muscle builder needs a rougher adjustment. A 92-year-old woman needs a gentle adjustment. You who've been told by doctors, don't see chiropractors, you need a gentle chiropractor. So the chiropractor you're seeing, ask him to be gentle. If he doesn't have that in his repertoire of different adjustments, leave your chiropractor, find a more gentle one. Let's close for one last segment. You know, I hope you guys are getting my spirit in this show. I get local chiropractors who call me from this show. When I tell patients, don't sit on a wallet, don't lay on a couch, girls, don't sit on top of your foot, here's what they say. We lose business when you give out this advice, and I don't care. My advice, if it helps the patient not to sit on a wallet, not to sit on their foot, and they see me less often, I guess like this week, I had no lunch breaks this week. I go 10, 12 hours a day without stopping. When you're this busy, you want to get patients better so they don't come as often. Maybe when you're not busy, you want them to sit on their wallet and cross their legs so that you get repeated business. I want to get people better in 3 or 4 visits. See you in 2 months. Make more room for other people. This show's theme is all about, I know you have been told not to see a chiropractor. And many of my patients, they'll say to me, my doctor told me not to see you. You've changed my life. I'm ignoring my doctor. I said, no, don't ignore him. Educate him. Let him know that you're coming to me once a month and all your pain is good and you're digging ditches and doing more than you ever did before because your spine is so degenerated that the rough chiropractic would hurt you. But there's a gentle chiropractic. So slowly, I'm getting attorneys now that are referring me because they know I'm more gentle. Attorneys used to say, don't go to a chiropractor because it would hurt their case, of course, if the patient got worse under a rough chiropractor's care. Now, lo and behold, some local doctors are referring me. It's a beautiful thing to get the ER to refer me. And I won't put names on the show, but maybe 5, 6 local doctors. It's a joy because they know Dr. John is gentle. He's not going to rack and crack you. You have been told by doctors not to see chiropractors because they have patients who have been hurt. Doctors have told me this. My patients get hurt by 3 or 4 local chiropractors. Those guys are so rough. And I've met those chiropractors. They lay you on your side and they crunch you. They crunch the other side. They get your neck and they yank it. They get your ears and they yank it. And they think that it's helping the patient. It's helping their ego. Here's the conversations I've had behind the scene. John, the more I crack all of their spine, their shoulders, their knees, their elbows, the more I crack, the more I'm going to impress the patient. And therefore, they're going to feel like they got their money's worth and they're going to come back to me. I say to them, that's your perspective. The patient's perspective is, the less you do, and you don't hurt me, but you get results. My headaches go away, my backache, my sciatica, my numbness thumb arm goes away. By maybe, it might take 10 gentle visits. That's what the patient is after, results. So my prayer is you as a consumer, you have to do your homework. There's good medical doctors, there's bad medical doctors. There's bad surgeons, there's good surgeons. There's bad chiropractors, there's good ones. I try to be my best. I'm not perfect. I hope this is not coming out that way. My point is to the consumer. If you are told by a doctor or anybody, don't see a chiropractor, their perspective is you'll get hurt. You should say to that person, wait a second. Do you know that there's gentle chiropractors out there? No, I don't. I thought they're all rough. Go to a gentle chiropractor. It'll change your life. It changed my life. Changed this man's life last week in Vero Beach. Then when your life is improved, you go back to that person and say, you know what? I understand your fears in telling me not to go to a chiropractor because you have 10 people that have been hurt by the rough chiropractors. That's why I did this show. I want you to understand there's different types of chiropractic. When I was younger, I just thought all chiropractors are the same. Don't they rack and crack and twist the spine? I don't. My whole body is healthy because, to be blunt, using a gentle technique is not just better for your body to get good results. It's better for my body. I don't have bad rotator cuffs and bad discs and stuff from all of that twisting. I will do this practice as long as I can. I will cut back as I get older. I'm not going to be doing this forever. So in conclusion, if you've ever been told, don't go to a chiropractor, use your own mind. Be your own person. If that person telling you is doing something that's going to help you, do it. But if nothing is helping you, look as a consumer for a chiropractor whose technique, there's 60 different chiropractic techniques. I use about 12 of the 60. 12 different techniques. Rougher with the young people, gentle with the 90-year-olds, medium with the medium, the 40, 50-year-olds, but extra gentle. When a neurologist says, don't get your neck cracked. When a surgeon says, don't get your back cracked. Those patients need gentle chiropractic. They need an honest practitioner who's going to say, we're going to be gentle, but it might take 2-3 months for these discs and spurs and things to rearrange gradually. And it is a joy when they come in and say, I don't believe it. I'm out golfing again for the first time in 10 years. I respect your time. I know time is valuable. Even me. Do you think I do these shows just for my own ego? There are times I thought about stopping these shows so I could be golfing out more. I pray you see my sincerity. I pray you see that I'm just trying my best to help you as a consumer to find a chiropractor who can service your body and not get hurt. So if it's not this office, you find a chiropractor who will listen to you and give you the type of chiropractic that will not hurt you. Don't listen to someone who says, don't go to a chiropractor. Make it a great day.